I'm Rob Wilson, President of Employco USA, and with me for this week's HR chat video is Jason Iceland, our Vice President of HR.
Hi, everyone.
Thanks for joining us for our HR chat. Our topic this week is healthcare as we look at 2021 and the effects of COVID-19, both on a claim standpoint, rate increase. So a lot of activities going on in health insurance right now, Jason.
Yeah, it's a crazy year. I hope everyone's safe and healthy. But in terms of health insurance and benefit plans, I've never, in the 20 years that I've been involved in this, I've never seen anything like this. This is the first year in one of the leading accounting firms. They usually put out a percentage increase, a projection of what they think the rates are going to be next year, and they've said we can't even peg it down to one number. It's going to be a 6% spread. So, and unfortunately, I think there's been a lot of people who also are going to be putting off elective procedures, and that's not going to trickle down for until 2021, 2022. We won't see some of these effects of the COVID for several years to come.
Yeah, we've seen some of our clients have had huge medical bills from COVID, whose employees have been in ICU or relatives, and so we've seen some as high as 40% rate increases, some as low as 10. So it's it's anybody's guess right now as you look into a new year. And like you said, because the claims so many of your data is trailing, a lot of people put off elective surgeries.
Yeah, and so going into next year, we're seeing anywhere from 5% to 15 is kind of in the normal wheelhouse. But we had one client that was 45% renewal, and we're going to get that down as far as we can and go out to market. But it's been a tough year for everybody, and what 2022 is going to look like, no one really has an idea yet either.
And so in the plan designs, what do you see in the most common? So the PPO has really, for a while, you saw high deductibles, HSAs, and HMOs, but is PPO, we've been doing too many PPP seminars and webinars. So PPO is still the most common?
Yeah, roughly around half of the plans out there, enrollment is in PPO style plans. Roughly about a third is in the high deductible health plans, the health savings account, and then the next trailing third to a quarter is in maybe HMO, POS style plans. Yeah, the PPO is still the big boy on the block. That kind of the most enrollment is found there.
And we're seeing, I think, as you saw years ago, you've been doing this too long. When I remember $250 deductibles and the point of service was the big rage. But I think right now your most common deductible you're probably seeing around a $2,000 range for companies to try and keep that healthcare costs affordable for their employees.
Yeah, the most typical is either 1,500 or 2,000. The average, according to a Kaiser survey, is 1,644. And that 1644 has driven up, I think, more than 25% over the last 5 years, more than 80% increase in deductible over the last decade, largely driven by that increase in popularity of the high deductible health plans. But yeah, PPO is still the popular one, and deductibles are going up just about every year.
Still gives you the PPO, still gives you the biggest variety of options.
Right.
Well, we try and make these short and quick, and feel free to reach out to either myself or Jason if you need any help on either benefits HR or any of our other services. Happy to help anytime.
HR@employco.com. Thank you.